Hi everyone. In this quick video, we're going to walk through how to document and bill for field avoidance in anesthesia. Accurate documentation is key to supporting appropriate reimbursement. Field avoidance is required when the surgical team asks the anesthesia provider to manage the airway away from the operative field, most often during head, neck, and upper chest procedures. This may involve techniques like using an oral or nasal ray tube, performing nasal intubation, or even jet ventilation. Typical cases are most ENT cases, facial surgeries, dental procedures, ophthalmic procedures, cases involving prone positioning such as spinal and back procedures. Anytime the anesthesia provider does not have direct access to the patient airway, the patient is turned away from the anesthesia provider, or the patient is placed in prone position, this would all be field avoidance cases. If you're using field avoidance, your anesthesia record should clearly describe why field avoidance was required, what technique you used, and any additional time, skills, and complexity involved. Here's an example of strong documentation. Field avoidance required due to surgical access to the face and neck. Nasal ray tube used to maintain unobstructed operative field. Intubation required additional preparation and positioning. If you are an anesthesia provider with guide anesthesia, remember to also mark the field avoidance on the billing sheet in the positioning box. From a billing perspective, field avoidance alone does not have a specific CPT code, but if the case involves significant increased complexity, you may consider adding modifier 22 to indicate increased procedural service. Certain health insurance companies will increase the number of billable units with this modifier. To recap, clearly state the reason for field avoidance, describe the specific airway technique used, and note any additional difficulties or planning. Field avoidance is a clinical decision, but it's also a billing opportunity. If documented well, increased revenue can be captured. Thank you for watching.